My Lords, I beg leave to ask the question standing in my name on the order paper.
My Lords, the commission from the Home Secretary is clear. He has asked Professor Dame Sally Davis to set up an expert clinical panel to provide advice to ministers on licence applications made by a patient's medical team for the use of cannabis-based products. Professor Dame Sally Davis is currently establishing a clinical panel who will agree the terms of reference.
My Lords, I applaud the Home Secretary for his decisive action on medical cannabis. My question relates to the second part of Professor Sally Davis's reviews. My noble Lords, Bedrocan cannabis medicines have been used very safely and successfully in Holland for more than 20 years and increasingly across Europe. These medicines are currently subject to 23 random controlled trials, and they are also approved by the European manufacturing standards. Can the Minister assure the House that the terms of reference for the wider review, and I'm not referring to the initial piece of work, will include the need for the MHRA, the Medicines Regulatory Authority, to consider defining a special category for whole plant cannabis medicines? And actually this idea came from within the MHRA, so I don't think it's unreasonable. But if the review fails to make these medicines available in this country, is the Minister aware that 200,000 people in the UK with uncontrolled epileptic seizures will continue to be brain damaged, further brain damaged, every single day? This is actually a matter of urgency.
Well, I'm grateful to the noble lady for her question, and like her, I also applaud the speed with which the Home Secretary and indeed the Health Secretary have acted in this matter. I think it's incredibly important to think about the various actions and stages that have been taken. First of all, there is an urgent need for a panel which Professor Davis is setting up to consider specific licence applications. The second part is to review whether there are therapeutic benefits for cannabis and cannabis-derived products, and that is where the evidence-gathering process, including the US National Academy of Science, which has done a major piece of work on this, the WHO is publishing a paper too, and of course all relevant evidence will be collected as part of that, which will, as the Home Secretary set out on Tuesday, make recommendations to the Advisory Council on the misuse of drugs subsequent to proposals for rescheduling, which will happen this autumn, if those proposals come forward. I think she raises, actually, if I may just take the time to say a third part as well, which is the long-term horizon scanning for those things for which there is not yet therapeutic benefit demonstrated, but maybe in the future for Schedule 1 drugs. We clearly need to set up a device to do that, and the MHRA may be the right vehicle for doing that, and that's something we are considering.
My Lords, can the Minister update the House on the number of cases the expert panel is expected to consider? Assuming they're current cases, can we be reassured that they will be dealt with in the way that avoids the awful situation faced by Alfie Dingley and his parents, and which will ensure they have the best possible medical treatment?
Well, I completely agree with the noble lady about the need for speed in this. We don't know the number of cases, to be frank, at this point in time. But what the Home Secretary did say on Tuesday is that the service will be up and running and receiving applications within a week from his statement. So from next Tuesday onwards, with the panel constituted rapidly so that they can start considering them.
My Lords, will my noble friend pass on the good wishes of this House to the Home Secretary and the Health Secretary for the speed with which they acted on making cannabis available, cannabis-based medication available for treatment of certain conditions. But will the Health Secretary also take steps to make people aware of the real damage which cannabis taking for recreational use can do to our young people, in particular creating paranoia and mental illness, and that it would be irresponsible for any government to condone the use of recreational cannabis, given the damage which is caused to our young people in some cases?
Well, I will pass on his thanks to my right honourable colleagues. We agree with him. There is a very, very clear distinction. We know that cannabis-based products can create harm. The question is, can they also have therapeutic benefits? If they can, then it needs to be weighed in the balance and rescheduled appropriately. But that doesn't diminish the impact, the negative impact of which he has described, that the recreational use of cannabis, particularly very strong strains, can have on young people.
showing that he quite clearly understands the distinction between recreational use and medicinal use. Is he also aware that Epidiolex, which is a medicine produced by GW Pharmaceuticals for epilepsy sufferers, and which will soon be approved, will not help children like Alfie Dingley who have uncontrolled epilepsy seizures? I understand that the cannabinoid CBDV is very important for such sufferers, and there isn't any of it in Epidiolex. So will the Minister ensure that the review takes account of the special needs of the 200,000 patients with uncontrollable seizures, and will it be able to hear from patients as well as studying research?
Well, the noble lady makes excellent points, and I know she's been deeply involved in the Alfie Dingley case, and I do thank her for her work on that. What we are discovering is that it's not the case that just one drug is going to fix this for the 200,000 people who are suffering. There is a need for variety. And so it cannot be the case that just because one thing is licensed, it is used for everybody. It needs to be specific to the needs of the patient, which is her main point. The interim panel is precisely there to make decisions on individual basis. It is a patch, if you like, to the system. It is not a long-term change, which is why the review is in place, so that we can make sure that many other products derived from cannabis, if they are proven to have therapeutic benefits, can be developed into drugs for the range of needs that are out there.
My Lords, 15 years ago...
This side.
My Lords, 15 years ago, there were trials being undertaken, one of which led to a separate authorisation of a derivative from cannabis for MS sufferers. Would the Minister be prepared, because I've not been clear from any of the reporting, what trials are currently taking place in this country that could be brought to fruition? What evidence we can very quickly obtain from trials and evidence of legitimate use for medicinal purposes from the rest of the democratic world, and how it can possibly be justifiable for us to provide 45% of usage for derivatives from cannabis grown in this country, but not to be able to use it ourselves.
Well, the noble lord speaks with great wisdom on this topic. As he knows, the problem is because these drugs have been in Schedule 1, although in theory that does allow for research, in reality it creates a very cautious environment that makes research difficult, which means that not only, although there is the drug that he mentioned, Sativex, that has been licensed, and Epidiolex, which is in the process of being licensing, there are very few, if any, other drugs actually going through the clinical trials process in this country because of the very tight rules that have governed its usage. Other countries have, of course, relaxed their rules. They have developed that evidence, and it's precisely that kind of evidence base that will be considered by Professor Davis in her review.
Business of the House, the Lord Privy Seal.
I beg to move the motion standing in my name on the order paper.
The question is that this motion be agreed to, as many of that opinion will say content. The contrary not content, the contents have.